Hey everyone, and welcome back to my channel. So today I'm going to be doing my 15-week pregnancy update. So usually with my week-to-week pregnancy updates, I really like to just start off with kind of reading off my Bump app and kind of giving you some insight on some of the things that you can see during week 15 of pregnancy. So at week 15, the baby is about the size of a navel orange, so 4.02 inches and 2.50 ounces. You probably can't feel it yet, but baby is squirming a ton and possibly also hiccuping. The baby is making lots of progress and now has the ability to move both its joints and limbs. Your body at week 15, you can be experiencing some nosebleeds and just overall sensitive nasal passages, which I've been experiencing a ton, which we will talk about, heartburn, gas, and or indigestion. You also can experience some swollen gums, which also comes along with the increase in hormones. So make sure you're taking care of your teeth and seeing your dentist regularly. So guys, with week 15, I definitely have been seeing some sensitivity, especially in the nasal area. I initially wanted to record this video on Monday. Today's now Wednesday, but I couldn't even get through recording it on Monday because I had the worst nosebleed. I just felt like I needed to blow my nose. And when I did, it was just nothing but blood. TMI, but I mean, if you're pregnant, there's a lot of things going on with your body as I speak, and a lot of them are TMI, and this is just one of those things that I've been experiencing. It was literally insane. I felt like it lasted at least a solid hour, and then it stopped. And then it ended up continuing. So it was like a nosebleed on and off throughout the entire afternoon. I tried doing everything that I can to kind of help with it. I tried to, pinch your nose, try not to, blow or irritate your nose more than it already is. Try to drink cold water, try to sit up, try to relax and see if that would help any. I just tried so many different things. So I feel like ever since Monday, anytime I feel like I need to blow my nose, I'm blowing so softly, you guys, to the point where probably nothing is even coming out because I'm just so paranoid that I'm gonna get another nosebleed, especially God forbid if it's in public, because that's just super gross. Also this week, I still have been pretty nauseous. So I still do have moments where I am actually vomiting. At one point I felt like I was feeling better, but honestly, it came back with vengeance. So I've still been suffering from that. So I've been taking the Ultrasound still to kind of help with that, because if I don't take it, I feel physically ill and then I can't eat or can't drink, and I just can't make it through the day. I've also been super tired, probably because I've just been in full mom mode. I can't even call it nesting yet because I'm not that far into pregnancy, so I can't even say it's pregnancy related, but I just have this urge to clean every single thing. I've been organizing the laundry room again, and I've been organizing cabinets, wiping and cleaning the kitchen non-stop. Even after I've cleaned it, I'm dusting things, I'm moving things, washing things. I cannot physically sit down. So I feel like that might be the huge reason why I feel sleepy now that I'm, got more energy and I'm just doing more things throughout the day. I do agree with the Bump app because I do feel like it's hard for me to fall asleep. It's not even that I can't get comfortable yet because my belly isn't super huge, but I just my mind is just going and going, and I just cannot physically relax. So last week I discussed with you guys that I was planning on getting an ultrasound. I got one at 14 weeks and 6 days, I believe. So that would be fixing the baby and hopefully see the gender. But the cord was literally in between the baby's legs. The ultrasound tech, she was looking and trying to explain different things, but the baby was rolling on its side, and we tried to do the 4D, and literally the entire cord is just wrapped in between the baby's basically cuddling it the same way I cuddle my body pillow. So they did like give me the gift card and things like that to come back and do another one, but the place is so far. It's so far, you guys, and just the fact that I would have to travel over an hour, it's and plus my husband was only able to go with me for that appointment because it was a holiday weekend and he already had off, but like these next few weekends it's gonna be insane for him. So it's like, do I want to travel almost 2 hours with 3 kids by myself to get an ultrasound for about 30-ish minutes and then drive another 2 hours back home? So that's kind of where I'm at right now. I don't know when I'm gonna make that trip, guys. I don't know if I mentioned it here. I'm pretty sure I did though. The reason why we decided to drive all the way to OKC to get this ultrasound is because my doctor's office does, you know, obviously do like an anatomy scan, which usually your doctor will tell you like, know the gender of the baby while you're there. But my doctor's office is like ridiculous, and I say that because they will do the anatomy scan and the anatomy scan only, but if you want them to tell you the gender, you have to pay them. So I've never had that situation before because with all of my other pregnancies at the anatomy scan, the technician is usually like, do you want to know, you know, like if they're in that area. But this doctor's office is like, we're not going to tell you the gender, we're just going to do the anatomy scan. If you want to know boy or girl, you got to pay. And I'm just like, you're already there. You're already getting paid for this ultrasound. My insurance is paying you. Why do I physically have to pay you extra money to find out the gender? It's crazy. And on top of that, my husband's military, so he can't just always just get off of work and come to these ultrasounds. So it's like he wouldn't be able to even go with me if I did want to get the ultrasound done at my actual doctor's office to find out the gender along with me. So that was literally your only option, was to drive almost 2 hours north just to find out the gender. It's so crazy. Like I've never heard that from an OBGYN's office. Never. Like if I known that prior to picking her as my OBGYN, then I would have just went elsewhere, to be honest, because even though we're currently in Oklahoma, I won't be delivering in Oklahoma because we're going to be PCSing soon. So we're not even going to be here. So she won't be delivering me. And if I knew that I could find a doctor just as good as her, but they weren't like, you know, all about the moolah, then I for sure would have went elsewhere. If you're in the military as well, or if your spouse is in the military and you're, you know, your military spouse, you're probably wondering like, why don't you just go and post? But the town we live in is so small to where just to even schedule my first appointment with my OBGYN, if I decided to go on post, I wouldn't even have seen that OBGYN until literally right now at 15 weeks. So I wouldn't have seen the doctor at 8 weeks. I wouldn't have gotten like an 8-week scan or even a checkup or heartbeat, none of that. And even then, some of the other spouses have been saying that it actually sometimes goes further than that, because they sometimes cancel your appointment and you have to reschedule because the doctor is that booked, or I should say the doctors are that booked. So you might not even see the doctor until you're like 6-7 months pregnant. And I am usually, you know, considered a high risk. Well, I don't want to say usually, I am a high risk pregnancy. So for me, waiting that long to see the baby, to see the heartbeat, to make sure everything's okay, it's just not an option for me. And the doctor I chose is pretty close to where we live at, to where I'm not traveling 2+ hours away to get some decent prenatal care. So it really does suck. But you know, that's just life. Everything doesn't go the way you want it. First world problems. But now I'm just rambling on. So I want to thank you guys so much for watching. Oh, and I'm gonna show you guys the bump and the cute ultrasound pic. This is my 15-week bump. That's the first picture. It's supposed to be a little baby's foot. The baby's heart rate was 148 beats per minute. I know with my last doctor's appointment it was at 160 something, so this is still within the normal range. And then here is the profile of the baby. You guys can see that. So stinking cute. There we go. Perfect. So yeah, so those are the pictures. That's the bump. Thank you guys so much for watching my 15-week pregnancy update, and I hope to see you guys in the next video.